Thanks, Jen. I'm just interested if you have any response to some of the moves made this week by a few Republican governors to get rid of, protections that were in place for people, public benefits, also public health restrictions, basically sending the message that the pandemic is over and sort of criticizing Washington, the CDC, the bureaucrats, as Ron DeSantis put it, for telling people they still need to wear masks indoors, those sorts of things, saying that the vaccines have worked. How are you trying to thread that needle by celebrating the progress of all the people who have been vaccinated and keeping these things in place, and also trying to keep people from viewing this through a political lens? Any outreach to any of these Republican state officials about the message they're sending and any response to them from the podium?
Sure. Well, first, we not only do a governor's call every single week with governors from across the country, from red states and blue states, to talk about implementation, any changes we're making to allocations, as we talked about just yesterday. But we also have regular engagement with governors and local officials about where the public health guidance is going, questions they have, and even sometimes challenges they have in their communities. Our position from the federal government continues to be that the public health guidelines are in place to keep people safe, not just governors and leaders of states, of course, but people in communities, families, kids, people who are in vulnerable populations, and that we'll continue to communicate that from the federal level, even as governors are pulling back their implementation in some places where it might be premature.
The president yesterday was talking about transitioning from the mass vaccination centers largely in urban and suburban areas and trying to really be more deliberate, proactive about getting the vaccine to people in outlying areas, rural areas. Is there any concern about having enough vaccinators to reach people in those areas? Will this mostly be run through local pharmacies, or is there going to be a similar effort to authorize different people in sort of medical fields to be able to administer vaccines?
Well, we did take that step some time ago to expand the type of individuals who are qualified to be vaccinators, because early on we recognized that it wasn't just about supply, it was also about locations. And obviously, as you alluded to, we've made some changes and adjustments, but also about vaccinators and ensuring that a larger group of individuals, dentists, veterinarians, others, could also be eligible to do the vaccine and get it into people's arms, because we want to ensure that in a range of communities across the country, there's a range of options for people who can do exactly that. So that's not a concern that we are tracking at this point in time, a lack of, because we did a lot of work preparing for those needs. And I would say that, there were some mass vaccination sites we opened even last week, but what we announced yesterday is a kind of a phased approach based on the phase we're in at this point in time, which is that we are recognizing the daily numbers will go down a bit because we're at such a high percentage rate relative to where people thought we were at this point in the pandemic. And we know it will be harder and harder to reach people and meet people where they are, hence the increase, as you suggested, in walk-in hours, or the announcement of walk-in hours on mobile units, on partnerships with primary care physicians and doctors to make it even easier and more accessible for people to get the vaccine.
Just one more on tomorrow on the trip to Louisiana. So far, the president has mostly traveled to states that are, competitive swing states. Louisiana